Hello and welcome to HSM 215. For today's class, we are discussing healthcare data classification. So there are three learning objectives. The first is to define the triple aim of data and identify sources of healthcare data. The second is to identify and differentiate different types of data. And then lastly, we're going to identify and define and differentiate data from population. And then finally talk about the data that we collect. So the triple aim. So the triple aim provides a comprehensive framework for improving healthcare and population health, improving patient experience of health, and reducing per capita cost. So basically, what this triple aim is meant to do is to help in decision making, and it does that by understanding the kind of data we should be looking for, in which we could be thinking about, the purpose for which we need the data. We could be looking at it from the side of trying to improve population health, or looking at it from the angle of trying to improve patient experience with healthcare, or trying to reduce per capita costs by trying to understanding how much it costs to take care of one patient. So and what the triple aim framework helps is to provide guidance, and part of the guidance is relating how to collect data, how to make decision based on the data, for like saying decision evidence-based approach. When we say evidence-based approach, evidence-based is basically is research, going by the data, the data from research that tells us this is what things are and this is things are not, because you need research to be able to guide you, because of the principles surrounding research and data collection in research. It kind of makes it such a way that it's the information you get out of research is something that you can rely on. So that is part of the what the framework does. And one of the very key question that the framework does help is in asking what sort of data should be collected, and the purpose of the data does help in answering that. So when we understand the purpose of the data, we are able to answer that question about what sort of data we should be collecting, and then the framework guides us towards that. So decision making with data. So health information is something that is very important when it comes to health decision making, and this is because when we use the application of mathematical principles to the data collection, data analysis, data interpretation, and the way we present data. What it does is to help us to prevent, manage, and treat health diseases and disorders. So we need the numbers to help us make sense of what is going on, because without having that good understanding of those, it may be a sort of a hit and miss. And with healthcare being as expensive as it is, we cannot afford to do hit and miss with health decision making. So that is where the application of mathematical principles come in, and making the data that we collect to be quite of high quality. So healthcare involves diverse sets of public and private data collection. When I say public data collection, is those sort of data that is publicly available. You could go, for instance, go on a website, on a database, and you are able to collect those information. For the most part, public data is usually de-identified, which means that the information that you collect there, you don't the data that is presented are usually data that you cannot identify who those data are coming from. So they are de-identified, which helps in protecting the privacy of the people that the data was collected from. Usually, private data are not de-identified, so you will be able to identify who really owns those data, and so that is why they are private. And there are some laws that govern how you use private data, and so with there's a lot of things that have been put in place to make it such that private data does contain there's some privacy that is ensured for the people who data has been collected from. And you can collect those data through health surveys. You could do that through administrative enrollment or billing records. For example, when you go to the hospital and you make payments, the data is collected on those billing methods. To let's use, for example, the research wants to figure out how much is spent on let's say getting eye examination or things like that, or getting eye contacts and stuff like that. So those information would come from an example, a billing record of a healthcare provider. And then you have the medical records, where you could get those from hospitals, physicians, and health insurance. So all of those, this health surveys are generally made public. Administrative enrollments and medical records are generally private. In order to make those information public, you have to de-identify it before they can make those public. So what are our sources of data? You can get data from population surveys. And some of the example of a population survey would be like a county health ranking. You can also, an example would also be Institute of Health Metrics and Evaluation that gives you national and international data. You can also get population surveys from Inter-University Consortium and social or for political and social research. So this is some of the examples of population surveys. There's so much more than these three that I just listed, just so that you that it's not limited to these three. You can also survey providers and institutions, and you can also get some of our sources of data can come from vital statistics. Generally, information on vital statistics can be giving you data on the births and the deaths and other life events. For an example, cancer diagnosis, for example. So those are the kind of information that you will get from vital statistics. You can also get data from registries of diseases. An example would also be data, cancer registries or HIV registries. So there are a number of sources of data that we can get those data. So now we can go into the second objective. We're going to discuss the types of data. So this image, I hope it's kind of big so that you understand. So in this image, we see four different types of data. We see clinical data, we see demographic data, we see financial data or socioeconomic data. So depending on what the purpose is, it can help us in classifying where that goes. For example, demographic data could be looking at in terms of gender or your medical record number. Socioeconomic will be asking questions on your marital status or your religion. You can have, financial data could be asking questions about what type of health insurance that you're collecting, or whether you have a copay. And then clinical data is usually the one we're very familiar with. They can be asking questions on diagnosis or temperature. So everything, there are a couple of those. We're not restricted. In this class, I'm going to talk about so many types of data. Please do not get confused by it. It's just basically to help you guys understand, that data can be classified in so many different ways. Sometimes it's the same data that gets classified in 2 or 3 different ways. So just understand there are multiple ways of classifying data. So one of the terms you're going to hear a lot with data is things like variable. With variable, we are looking at an item or characteristics that you may want to measure. An example would be what the patient weight is, what the patient blood glucose level is, or what the patient's sex is. Those become items that you want to measure. So, and then we also have values. Values are individual count of observation for a variable. So you have value, variable, and values going hand in hand, or I will show you what I mean by that. So, for example, we have a patient's weight, and let's say this patient weight is 196 pounds, and there's their blood glucose level that goes at 100, more than 140. And then we have the patient's sex, and in this case, let's say it is a female. So this weight, blood glucose level, sex, will indicates these are the variables. So when we say this, and then this become the value. So you have the value and the variable and values going hand in hand. So with the variable is the characteristics that we are looking for, and then the value is the count or observation for the corresponding variable that we are interested in. Another term you probably hear me say is data sets. So data sets is a collection of related sets of data or information. And let's use, for example, there's a data set was on type 2 diabetes management among young people in Hammond. So that's diabetes, that's data set. The information that you're going to get in that data set is going to be related to type 2 diabetes. Sometimes data sets is done based on the year that the data is collected or the location from which the data is collected. So there is no one fixed data sets. Like if you say data set, it doesn't mean that it's only related to diabetes management. It's just a way of helping someone to understand that the data is related. The information that is in there is related. So it's a collection of related data information. So data sets generally contain multiple variables, could go into the hundreds, depending on how large the data set is. Some data set can also be small, also depending on the information that you have. So you can have a variable, like 5 variables, a data set with 5 variables, or you could be dealing with a data set with 100 or 200 variables. It just basically depends. Another term you're going to hear is database. So with database, we are dealing with multiple data sets. So they are, let's use, for example, we collect a data set for type 2 diabetes management, and we do that for 2020, 2021, 2022, 2023. So this 4 different data sets, if we combine them into one place, it becomes a database. So with database, we're dealing with multiple data sets. So just want to talk a little bit more about data terminologies, some terms that you're going to hear a lot when it comes to data, and this all fit in with the types of data. You can have question that is asked about the type of variable. With type of variables, we are looking at things like whether it's a categorical or qualitative data, or we could be looking at whether it is a numeric or quantitative data. We could also be looking at it in terms of the type of data for which we may be looking in terms of whether it's discrete or it is continuous. And then we could also be looking in terms of the scale of the data. And here we are looking at in terms of nominal, ordinal, ratio, interval. So this terminology or types of data are going to be things you are going to come across a lot when it comes to data. You just need to understand how those terms are used and for which it is used. So these are the terms. The categorical are, some of the types that is generally used in classifying variables. Discrete continuous is a type used in classifying data or the value, and nominal, ordinal are used in scale of measurements, the scale of the measurement of the value. So that you guys understand it. So there you may also see an image like this when you talk about types of data, and here everything is all jumbled up together, and it kind of tries to demarcate it or separate it. So you have this categorical variable, which although they use the word data here, and you have numerical data as well. So under categorical, you may be dealing with nominal data or ordinal data. That's the scale of measurement for the data, or you could have discrete data and continuous data. So there are different ways that data is classified, but with time you're going to get more familiar with it, so that you don't get completely thrown off depending on the image that you see or how you see it used. Just understand there are different ways of classifying data. So I'm kind of want to explain a little bit what scale of measurements are. With nominal data, we are kind of looking at the number that is assigned to a runner. I'm going to use an example of a race in this case. So the number that is assigned to a runner, and let's say there's a finishing line, and the first person to get to the finishing line has the number 17, because runners have numbers on them. And then the second person has a number 48, and the third person has a number 5. So you can see that the numbers that they have on their clothes or their shirts has nothing to do with how they, how it is that they got to the finish line. These numbers are just existing on their own. But you could be talking about it in terms of ordinal, in which case we are looking at the rank order of the winner, and also using the finish line, where we have the person who with number 17 is the first person to finish, and person with number 48 was the second person to finish, and person with number 5 is the third person to finish. So you can understand that nominal and ordinal don't, it really all depends on what it is that you're using the data to do. With interval, interval is an example of, to explain it, would be performance rating of the runners. Let's say someone is rating them based off on in the scale of 0.0 to 10, whereby the third person is kind of rated at 8.4, based averaging all the different people that ranked them. The third person, let's say, is ranked at averaged at 9.3, and the first person averaged at 9.6. You could also be looking at it in terms of ratio, which will be, let's say, time to finish in minutes and seconds. So third person finished at 15 minutes 2 seconds, second person 40 minutes 1 second, and first place was 30 minutes 4 seconds. So this kind of gives you an idea of what these different scales of measurement is, and how it is how you can identify it. So you may have a data set that has all of these different scales of measurements in them. So it's data sets can have all of them, just so that you guys understand. If you see a reference to a data set and you have all of the scales of measurements in them. So this definition would also help you in kind of having a clearer understanding of the measurement scale. So you can pause this video at this point and just kind of read through. It's a bit tiny, but you may need to zoom in to get a clearer image of it. So lastly, we're going to talk about sample and population. So with sample and population, one way to look at it would be to look at in terms of how you are, in terms of what type of data that it is. Um, uh, for data, primary data, we are looking for data based off on how the data is collected. So with primary versus secondary data is kind of this this classification of data is focused on how the data was collected. Primary data, it means that the person who needed the data went out and got it from the different people that they needed the data from. And you could have, researchers and analytics going out, at the time of their research to go and pull up those information. I'm going to give you an example later so that you don't get confused about that. With secondary data, somebody else collected the data, did all of their thing, and then they stored it somewhere, say in a database or a data set. And usually they have to be publicly available, meaning that they are also de-identified. And then you need the data, and so you go into those data sets or databases to go and pull up that information. So that is something to be aware of in terms of that. So and some of the places you can get this de-identified secondary data could be on census, and some of the censuses do have a lot of information, including housing, social security, tax records, and stuff like that. And then you could get those from internet or libraries, GPS, remote sensing, and you can also pull up some data from journal papers. By the time we get into HSM 375, you're going to kind of become a little bit more familiar with pulling data out of journal papers. We're not going to do that for, mostly not going to do that for this course, but just to be aware that you can pull up data from journal papers. So this image kind of shows you and to kind of helps you in differentiating primary data and secondary data. So you can see with the primary data, somebody goes into the different houses and collects those data, and then the information that is collected from the data, it feeds it into the census website. And let's say this is me who wants to do data analysis, and I cannot afford to go into all of these houses to collect data because this is quite expensive to do. So instead, what I get to do is to go into the census website and pull up the information that they had already collected from the different people. So depending, let's say I have a lot of money for my research, I could directly go into the household to pull up this information, which becomes a primary data, or I could just go to the census website and pull this up, and that becomes a secondary data. So how do we differentiate between population and sample? So with population, we're kind of looking at it in terms of representative of a sample of a large group, right? And of people in one or two characteristics in common. So let's say you are interested in young people in the US. You are not probably going to let's say you're interested in young people in the US. So one of the characteristics that you're going to be interested in would be their age, because you're interested in young people in the US. So you're using the age to help you in identifying that population. You could also be looking at it in terms of where they live. Like for an example would be them living in urban areas, in which you'll be going, the population you'll be interested in is the people who live in urban areas. Or you could be interested in them based off on their ethnicity. You're only interested in men with the population that are men and are Hispanic. So that would be where you are getting, that would be the kind of population that you are looking to. So population generally does not cover everybody. You're generally, there's a common characteristics that you are using to kind of pull up from that group of everybody and saying, I want this specific type of people. So some research collects data on everybody. Some research kind of limits it to a population, depending on what the purpose of the data is. Now, population versus sample. With sample, what we're doing is taking a fraction of the population. So now let's just, for example, you are a researcher and you are interested in researching about Hispanic men. And let's say Hispanic men that live in Hammond. This is probably going to be hundreds of people, maybe 5,000 or 50,000 Hispanic men that live in Hammond, and you want to do a research on Hispanic men that live in Hammond. It's unlikely that you have the amount of money that is going to take to research on, on 50,000 Hispanic men. So, but what you may want to do is to collect a sample of, say, 500 Hispanic men to do your research. And the result you get from that 500 Hispanic men, you would use to kind of extrapolate to all Hispanic men that live in Hammond. So those 500 Hispanic men that you pulled out of the population of Hispanic men in Hammond becomes for you a sample. As you can see in the image, everybody here in this sample is also in the population. So sample just pulls out a few people from the population to do the data to help make sense of what is happening in a population. So some research, the really wealthy researchers, or usually government agencies, have the money to go into and collect population information. But for the vast majority of people, they cannot afford those population level research, so they kind of focus on samples. Usually they are smaller in size. So the data that you get to collect depends a lot on the purpose that you need it for. So let's use, for example, I'm a researcher and I am interested in how, the question that I want to ask in my research is how many Hispanic women of childbearing age live, that are living in southeastern Louisiana have insurance coverage. So I want to know how many Hispanic women who are of childbearing age who live in southeastern Louisiana have insurance coverage. So this research question, or this question that I'm trying to answer with my research, helps me in determining what type of values and variables I should be collecting. And a variable to collect would be in the gender of the people, in which I'll be asking questions about whether it's this the male or female, and I could looking at age because I'm interested in childbearing age. I'll be asking trying to collect data on the age. Now I can either collect the value as a numerical value, in which I'm or a discrete number. We're looking at what is their specific age, 15, 16, 17. Or I could be collecting the information based on categorical, whereby I am grouping different people into age groups. So everybody who is 15 to 20 becomes one age group, and anybody who is 21 to 25 becomes an age group. So there are different ways I can collect age related data. Then with insurance coverage, I'm trying to the values I will be kind of looking for is yes, they have insurance, or no, they don't have insurance. And then location, let's say I'm interested in knowing what's going on with different locations, whether, let's use for example, some places in southeastern Louisiana have more coverage versus the other, in which I'll be asking questions, whether you live in Hammond or different places in southeast Louisiana. So what data collection would I use to get this? So I could use primary data, in which I'm having researchers visit every single house in southeastern Louisiana, and this is if I'm looking at it from a population angle. Or I could decide let them go to 50 house in southeastern Louisiana to collect those data. So that becomes a primary data. Or I could say, instead of going to the houses, by myself, let me just go to a secondary data, a data base, and pull up that information. And let's say the database that I'm going to is the all payers claim databases. So the information that I need to answer my question will be in the database. I will be able to pull out information on gender, on age, on insurance coverage, on location from that database. I don't have to go to either every houses or just a few houses to collect to pull up those information. So those are the, when you know what sort of information that you want, what your purpose of your research is, it helps you in identifying the variables and the values to collect, and makes you get to answer the question of what data collection method that you're going to use it for. So this is where we end for today's class. Remember to, if you have any question concerning anything that I've covered here, or any part of the assignment, to please post it on the Q&A board. Do have a lovely day. Bye.